I want to ask you, a lot of people would ask this, if not the vaccine, then what? How could have we moved forward given the situation that we had at hand?
Yeah, so you and I had
Yes.
you're a good journalist. I want to commend you for a tough bulldog approach. I think that that's respectfully a misleading question, because I've just said the vaccines didn't work. Maybe your vaccine worked. I don't have the internal documents. I invite your manufacturer to release their internal documents so my experts can take a look at what was provided here in India and other countries where your vaccine was distributed. But the vaccine didn't work. So as I said to you when you asked me that earlier, when humans are faced with something, a technology that does not work, they keep looking for solutions. That's not what happened. People who early on, doctors who were using other methods of treating COVID and keeping their patients out of the hospital, keeping their patients from getting sicker. Those methods include, in my country, hydroxychloroquine and ivermectin. They were having good outcomes, high doses of vitamin C. Those doctors were delicensed in my country. They were certainly canceled and censored. They lost their jobs. They faced lawfare. They were made fun of. The FDA released a whole marketing campaign. I'm sorry, it was the CDC making fun of ivermectin, as you may recall. So again, I'm not a medical doctor, but these were some other methods that were showing promise. They were suppressed, and everything was directed, including force in my country, economic force, threats, shaming, legal discrimination, into, compelling people to take this injection, which the manufacturers, the White House, the CDC, we have emails among Dr. Fauci, Dr. Walensky, 15 White House staffers. They knew by April of 2021 that this injection was hurting the hearts of minors and young, healthy adult males. They kept pushing it anyway. They didn't come clean. So I would say to you, there are many other things that could well have helped, but they were prevented from being explored.
So people were convinced that the vaccine works because the data was published and it was peer-reviewed and published.
What data? I asked you this in our conversation.
Yes,
what data?
There was peer-reviewed data.
What peer-reviewed data?
That spoke about the efficacy of the vaccine.
What peer-reviewed data?
Published on the NHAM and the BMJ.
What study? You'll have to show me, what you're referring to so I can look at it.
What I'm trying to ask you is that people were immediately drawn to the vaccine because of data that the government spoke about as well, and Pfizer was in conversation for the longest time to come to India as well, but that never worked out. That's the reason why people had faith on the vaccine. A lot of people did. India as a country vaccinates a lot, and that's the reason why it was not very difficult to get people to come and take the vaccine, unlike many other countries. So
which vaccine did people get in India?
In India, people got two vaccines. One was covishield, which is the astrazeneca vaccine, the adenovirus vaccine. And the second one was a indigenous covaxin, which was an inactivated vaccine.
So just a point of information.
Yes.
You know that the AstraZeneca vaccine was withdrawn from the market.
Yes, but my question is about the Pfizer vaccines.
Right.
The data that was published showing efficacy, and that's how it was introduced.
I'm not trying to badger you. I'm really not. What data? I mean, you're saying to me...
I can get into the details of that data and what it showed, the percentages of the efficacy levels, but what I'm saying is that the vaccine was introduced, an emergency authorization was given. One of the first vaccines to get an emergency authorization was the Pfizer vaccine. The WHO backed it, the CDC backed it. What I'm asking is that what was going on for them to get, behind the scenes, as per your research, is what I'm trying to ask you. So these clearances were given, and that's how the vaccine was introduced to the population. What was going on behind the scenes for these clearances to come through?
I see. I understand your question. Again, I hope you'll understand when I say over and over what data, I'm really encouraging kind of a revolution in our sense of our responsibility as consumers of information. And what I mean by that is it's very important for us no longer to say, well, those are the doctors, they're the experts, or those are the scientists, they're the experts, or that's the media, they're the experts. I don't mean you. India Today is fabulous. Or, that's the CDC or the FDA, they're the experts. We really need to, and this complete collapse of trustworthiness of the FDA, the CDC, the American media, the Western media, in terms of reporting things that were not true or that were skewed scientifically, and that's why I keep saying what data, and I'll get to that in a minute, we have to start to read those studies ourselves and evaluate them ourselves and become literate scientifically. I started out by saying I'm an English, like my DPhil is in English literature. I'm not trained as a scientist, but now I know how to read a scientific paper. It's not rocket science, you know, and I know how to see flaws in methodology. And we all have to get accustomed to that, because you asked, what was this process? What happened was millions of dollars flowed, we now know, to journals like The Lancet, the British Medical Journal, the gold standard peer-reviewed scientific and medical publications. And then they would not publish good science that showed problems with the vaccine, but they would publish what turned out to be very bad studies, flawed studies, that claimed to show safety and efficacy. One example is just the Shimabukuro study, peer-reviewed, that early on was used by the CDC, by public health entities throughout North America, to tell pregnant women that this vaccine was safe for their fetuses and for themselves. It wasn't safe, and the way they got to that was by stopping looking at babies after 2 weeks, right? As well as other flaws in methodology. But this was very common. The peer-reviewed process has been compromised. Another example is the PCR test. The PCR test, which is what was used to identify infections, right? It's a real test, but the inventor of it said, don't use it at too high a cycle threshold or it will generate false positives. The World Health Organization issued a press release that was quickly swallowed up that said don't run it at high cycle thresholds. But governments and testing centers ran it at cycle thresholds that are too high, generating untold false positives. So our data about the extent of the pandemic can't be verified based on PCR tests.
So you also feel that the pandemic in that sense were exaggerated in terms of the numbers?
I don't know. Like, I don't know. As a journalist, I'm saying there's a problem with a lot of the data.